Okay, hi everyone, welcome to this video. Today I will be presenting on the human blood circulatory system. And my name is Chye Wei and I'm a year 1 medical student from UMS. So this presentation will cover topics such as the anatomy, physiology and biochemistry. And lastly, I will also be talking about some of the related disease in this system and also its technological advancement. And now before we start, I want to introduce to everyone a very famous cardiologist. His name is Werner Theodor Otto Forssmann. Now, this doctor studied in the School of Medicine at Friedrich Wilhelms University, and after World War II, it's known as the Humboldt University. So, why is this person famous? What did he contribute? So, this doctor is known for performing the world's first human cardiac catheterization, and he performed it on himself. And how he did was he used only a mirror, and he advanced a catheter under fluoroscopic control. And then once the catheter was inside his own arteries, he went to the X-ray department to take X-ray of his own chest film. And here we can see this was the X-ray taken, and we can see that this white line is a catheter that he inserted in his own body. So why did he do this? He did this because he wanted to invent a new way to administer drug directly to the heart, and also this method is able to be used for diagnosis purposes. And after discovering this technique, he received the Nobel Prize in Physiology or Medicine in 1956, together with two other doctors here in this image. And this guy in the middle is Werner Forssmann. So next we will be looking more in depth on the human blood circulatory system. So first of all, I will be explaining on the anatomy. We have three components. The first is the blood vessel, and next is the heart. So first we will be looking at the blood first. Now the blood consists of form element and the plasma. The form element are the blood cells, such as erythrocytes and leukocytes, we can see in this image here. And the plasma is a liquid, a yellowish liquid that holds all the blood cells together. And it also plays an important role in maintaining tissue homeostasis. So what are the example of blood cells found inside the plasma? So first we can see the erythrocyte or red blood cell. We know it is used to transport oxygen. Then next we can see the platelets. The platelets is a cell fragment that breaks off from a megakaryocyte. A megakaryocyte is a large cell and it will break off to form fragments called as platelets, and it is important in blood clotting. And then next, this is all our leukocytes, and we can categorize leukocytes into granular and agranular leukocytes. Granular means we can see granules in the cytoplasm, and agranular is we cannot find any granule in its cytoplasm. So for granular leukocytes, we can there is neutrophil, eosinophil, and basophil. Neutrophil is plays an important role in phagocytosis. Eosinophil kills parasitic worm, and basophil prevents blood clotting. And next, for the agranular leukocytes, we have the most important one, which is the T lymphocytes and B lymphocytes. These two are responsible for producing antibodies. And here we can see that the B lymphocyte, it will once it is activated, we can see it is differentiated into plasma cells, and it will produce antibodies. And next is the monocyte. Now this monocyte, it will diffuse into between the tissue spaces and differentiate into a macrophage. A macrophage is almost similar to neutrophil. It also phagocytizes antigens, but the difference is the macrophage is more efficient because it is able to phagocytize a large number of particles at once. Okay, so moving on is the blood vessels. Now for the blood vessels, we need to know its structure and its types. So for the blood vessels, there are three structures: the tunica externa, tunica media, and tunica intima. And we can see here the tunica externa is the outermost layer, the tunica media is the middle layer, and the tunica intima is the inner layer, inner lining of the blood vessel. So this tunica externa, it is mainly made out of collagen fiber, and tunica media is mainly made out of smooth muscle fiber and elastic fiber. Now this smooth muscle fiber and elastic fiber is important so that the smooth muscle fiber will carry out vasoconstriction and vasodilation. It can contract and relax, and the elastic fiber, it allows for the recoil and expansion of the arteries to withstand the high blood pressure when the heart pumps. And tunica intima, it is a single layer of endothelium. Endothelium is a specialized simple squamous epithelium that lines the walls of the blood vessels. And for its types, we have the arteries, the veins, and the capillaries. So we can see here the difference between arteries, veins, and capillary. So for artery, the thickest layer is the tunica media. You can see here the thickest layer is the tunica media, whereas for the vein, the thickest layer is the tunica externa. And capillary, we only have a single layer, which is the tunica intima, and it is a single layer of endothelium for the diffusion of substances, so that substances can diffuse easily in and out of the blood vessel. And here we can see that the artery and the vein is connected through capillary. Okay. And next we will be looking at the heart. So first of all, we need to know the heart border. The heart has four borders: the superior border here, the right border, the left border, and the inferior border. Now the superior border is mainly made of the three great vessels, and the right and left atrium, the right border is made of the right atrium. the left border is made of the left ventricle, and the inferior border is made of the right ventricle. And if you look in the 3D view, we can see its surface. We also have 4 surfaces. The first one is the sternocostal surface, which is in front of the sternum, at the front behind our sternum, and the right pulmonary surface, the left pulmonary surface, and the diaphragmatic surface. The diaphragmatic surface is the surface touching the diaphragm, the below part of the heart. Next, we will be looking at the pericardium. Now here we can see the structure of the pericardium. For the pericardium, it is a double wall sac composed of the superficial fibrous pericardium, and deeper there's a 2-layer serous pericardium. So the outermost layer is the fibrous layer, and inside we have another 2-layer, which is the visceral layer and the parietal layer. Now, for the heart wall, it is made out of the 3-layer also. The first one is the visceral layer of the serous pericardium. Now this is the epicardium, and the myocardium has the cardiac muscle, and the endocardium is the endothelium lining. So next, the heart also have 2 septum, the interatrial septum and the interventricular septum. Now here we can see clearly there's a wall dividing, we call this the interventricular septum. And between the atrium, there's also a wall dividing both atrium, we call it the interatrial septum. And for the valves, there are also 4 valves. We have the pulmonary valve, this is the pulmonary valve, the aortic valve, the mitral valve, and the tricuspid valve. And when we open up the heart and look at the atrium, we can see the walls is marked by pectinate muscle. It is actually a horizontal muscle fiber. And for ventricles, it is marked by trabecular cardia and also tendinous cords. Marked by trabecular cardia and papillary muscle, and tendinous cords will be attached to all these papillary muscle holding the cusp of the valves. And next, another important part is the coronary circulation. Now the coronary circulation is the blood supply for the heart itself. We have the coronary artery and coronary vein. And here we can look at some of the example. The important one are the right coronary artery, the left coronary artery, and it will branch into the circumflex branch and the anterior interventricular branch. And then behind there's also a posterior interventricular branch. And for the coronary vein, it originates from a major vein called the coronary sinus. And then between the ventricle, we have the great cardiac vein, and behind we have the middle cardiac vein. And then accompanying the right marginal branch, we have the small cardiac vein. Next, we will be looking at the physiology of the heart. Now there's 2 important topics. The first is the cardiac conduction system, and the second is the cardiac cycle. So the cardiac conduction system is how the heart generates action potential or electrical impulses for the heart to contract by itself. So it starts from the SA node. The SA node is a primary pacemaker, and it will spread to the internodal pathway throughout the atrium, and then it will converge to the AV node, and at this point it will slow down, and after the AV node it will traverse to the main bundle of His, and then there's the left and right bundle of His, and then it will spread across throughout the whole ventricle through the Purkinje fiber. And so here's a fun fact. So if the SA node fail, the AV node will actually take over as a secondary pacemaker and perform its function. So for the cardiac cycle, there are three cycles. First is the atrial systole, ventricular systole, and late diastole. So for the atrial systole, the atrial will first contract, as we can see here, contract, and the blood will flow into the ventricle. Now when the atrium contracts, it adds a small volume of blood, which is 25 ml, and previously there is already blood within the ventricles. So end up we will have an end diastolic volume of 130 ml. And in this phase, the AV valves are open and the SL valves are closed. And next we'll move on to the ventricular systole. So during ventricular systole, the ventricles are depolarized and it will contract, while at the same time the atrial undergo repolarization and it will relax. So when the ventricle contracts, it will push the blood against the cusp of the AV valves, which is the tricuspid and mitral valve, and it will force it to close. Now, the first stage is the isovolumic contraction. So in this phase, all 4 valves are closed, and because the pressure in the ventricles are lower than the pressure in the aorta and pulmonary trunk. Now, when the ventricles continue to contract and the pressure increases, it actually forces the aortic and pulmonary valve to open and ventricular ejection occurs. So when this occurs, the SL valves are forced open and the AV valves are closed. Now, the heart will actually only eject 70 ml of blood, and there's an end systolic volume or remaining of 60 ml of blood inside the ventricles. So the last is the diastole. So in diastole, the ventricles are repolarized and both the ventricles and atrium are relaxed in this phase. So when the ventricle relaxes, the blood will start to flow backwards and push against the cusp of the aortic and pulmonary valve, forcing the AV valve to close. Now the first stage is isovolumic relaxation. This is another stage where all 4 valves are closed because the pressure in the atrium is lesser than the pressure in the ventricle. So as the blood fills the atrium during a ventricular systole, it will start filling and the pressure will start building up, and it will force the tricuspid and mitral valve to open. So here we can see the ventricular filling occurs and the AV valves are forced open while the SL valves are closed. Now this fills the ventricles with 105 ml of blood. So this 105 ml is contributed during the atrial systole, where the atrial systole will add a small volume of 25 ml of blood, and 25 plus 105 equals to 130 ml of blood. So next we will be looking at the biochemistry. So one of the important topic in the biochemistry of the blood circulatory system is the blood group. Now we have two major, there's actually a lot of grouping system, but we have two major systems, which is the ABO blood group and the rhesus blood group. And in blood group, we have to look at two things. The first is the antigens and the second is the antibodies. So first, antigens are present on the surface of red blood cell, and it is actually made from glycoproteins or glycolipids controlled by genes. So here we can see the glycolipid chain. This is the O antigen, this is the A antigen, and this is the B antigen made from different sugars. So for ABO blood group, there is a two antigen, antigen A and antigen B, and for the rhesus blood group, there's antigen D only. And moving on is the antibodies found in the blood plasma. For ABO blood group, there's anti-A and anti-B antibodies. For rhesus blood group, there's only anti-D antibodies. As we can see here, type A we have anti-B antibodies, and type B we have anti-A antibodies, and type O we have both anti-A and anti-B antibodies. Now the difference for antibodies in ABO blood group and rhesus blood group is, for ABO blood group, the antibodies are actually naturally occurring following birth. Means it is already inside the blood plasma when we were born. But for the rhesus blood group, the anti-D antibodies are actually only produced when exposed to foreign antigens. So it will only be produced when it detects antigen D in the blood. So why this is important is because it will only cause complications during the second transfusion of pregnancy as compared to the ABO blood group. And here we can see other examples of what happened when a male with rhesus positive marries a female with rhesus negative. And the complication will only start during the second pregnancy. So last, we will be looking at the disease and the technology. So one of the disease in this blood circulatory system is the acute coronary syndrome. Now what is this? It is a range of condition related to a sudden reduced blood flow to the heart. An example of this condition are STEMI and STEMI and unstable angina. STEMI is ST elevation myocardial infarction. Myocardial infarction is heart attack, and STEMI is non-ST elevation myocardial infarction. Now why this will happen is because it is caused by atherosclerosis, and the decrease in blood flow happen when the plaque rupture and the blood clot starts to form in the coronary arteries. So how do we diagnose this? Is through looking at the clinical symptoms. One of the most common clinical symptoms is chest pain and ECG interpretation, which is the ST changes. We can see that ST segment is either elevated or depressed. And the last is the serum cardiac markers, which is the troponin T and troponin I. These two will be taken to the lab, and we will measure the level of troponin T and troponin I. A high level indicates myocardial infarction. So what happened? The doctors will do for surgical intervention. The doctors may do a balloon angioplasty or CABG, known as coronary artery bypass graft. A balloon angioplasty is a doctor will insert a catheter into the coronary arteries, and then using a balloon technology, inflate, pushing out to widen the lumen of the coronary artery so that blood can flow. And the coronary artery bypass graft is the surgeon will take a graft from another part of the body and use as a bypass graft to bypass the site of the blockage in the coronary arteries. And some of the pharmacological intervention is the doctors may also prescribe some antiplatelet drugs such as aspirin and clopidogrel, and also some anticoagulant drugs such as heparin and warfarin. Now, one of the technological advancement is the coronary angiography. Like I mentioned just now, this only happened because the Werner Forssman developed this cardiac catheterization technology. So this is a medical imaging procedure used to visualize the location of the blockage in the coronary arteries, and also its severity of stenosis, or the degree of occlusion or blockage of the coronary arteries. So here we can see a normal picture of a coronary artery where there's no blockage, and here we can see that there is suddenly a decreased blood flow in this area. Now this is called an occlusion or stenosis, and this is quite severe, which is a 95% stenosis. So how this procedure is carried out is an access will be gained through the femoral or radial artery, and a catheter is used to advance through the appropriate coronary artery, and then they will inject a contrast or dye so that when the X-ray is taken, we can see how the blood flows in the coronary arteries. So that's all for my presentation. Thank you very much. Thank you for watching this video as well.